Welcome back to the KDPG Sunday edition. This morning we're talking about a mysterious virus with polio-like symptoms, acute flaccid myelitis, or AFM, which has stricken children in at least 22 states, including Pennsylvania and here in Pittsburgh. Back with us, Mish Adalja, senior scholar at the Bloomberg School of Public Health at Johns Hopkins University. He's based here in Pittsburgh. Also joining us is Dr. Karen Hacker, director of Allegheny County Health Department. Dr. Hacker also serves as adjunct professor in the departments of Health Policy and Management and Behavioral Community Health Sciences at the University of Pittsburgh's Graduate School of Public Health. Also joining us, of course, is Sally Staple, the managing editor of the Pittsburgh Post-Gazette. Dr. Hacker, how many cases do we have here in the Pittsburgh region?
So right now we have 3 children that were confirmed. Only 2 of them are Allegheny County residents. One, I believe, is from Washington County. And then very recently we had 3 additional cases that were suspected, so they haven't been fully confirmed as yet.
What will take place to try to confirm whether it is AFM or not?
So tests are being sent, samples are being sent to the Centers for Disease Control. They're really the final sort of organization that will make that confirmation for us, and we await those tests.
Of those 3, are they also in the Allegheny County?
Yes, all 3 are Allegheny County residents.
Do you know of any of these cases outside of Allegheny County,
well,
except for Washington County?
We had Washington. I have not heard about others in the state. I don't know if you've heard.
I think there's one in the eastern side, one in the eastern side of the state.
So we've had more here than they have in the eastern side.
I think that's just a reflection of reporting and how, you know, in the midst of war here, kind of with this, trying to figure out what's going on with these cases and getting doctors to be aware of them and get testing going forward. So I'm not surprised that you'll see more cases on the east or the west. It's all going to kind of vary until we get.
The reason I bring that up is because I believe it was in Minnesota that there was like a cluster, which really was the first kind of alarm that went off for the public, at least, that there.
Oh, actually in Colorado as well.
Well, it's Colorado as well. So, you know, is it? You don't know, I guess, whether it has any basis at all in particular regions, weather or environmental issues?
You know, I think you heard from the prior folks who were here, from Dr. Williams, that this is such a rare complication of so many different types of viruses. And these are viruses that circulate normally during this period of time. And you've got the kids going back to school and things like that. You know, I think anybody who has children knows that September is often the, month of viruses, right? And everybody gets sick. So I think one of the biggest challenges is certainly how do we explain as public health authorities to our citizenry the things that we do and don't know about this particular situation, to calm their concerns, but at the same time be very realistic about what we do know.
You know, Minnesota Senator Amy Klobuchar had the big, we're going to the CDC with this after the Minnesota cases. So share with us, if you will, kind of the behind the scenes that you're getting from the CDC. What are they saying? How are they treating this different than other virus nationwide illnesses that we've had in the past?
Well, at least from my perspective as a health department, we work very closely with both the Pennsylvania Department of Health and the Centers for Disease Control. As you know, all of the samples are going to the Centers for Disease Control. They are very interested, obviously, in monitoring this nationwide, and doing the testing that needs to be done so that they can better identify what the causal agents might be. In many cases, we are taking our leads from them, obviously. We are also doing the typical investigations that we do in any type of infectious situation to determine whether there are commonalities between cases and reporting that back to the Centers for Disease Control. So we have regular communication with them, and I think it's really imperative that we look to our national experts as we begin to explore and learn more about these types of conditions.
So it was yesterday that we learned that there are 3 suspected cases. What was their response to that here following on the heels of the 3 known ones?
So I'm sure you could sort of comment to this. I mean, first of all, I don't think that they're surprised because in these clusters, there has often been more than several cases.
Right, so it's going to take some time to let all the dust settle and see how many cases are suspect to confirm. But I don't think that we should be surprised to hear about new cases being discovered. There is a lot of public awareness going on, and we want to capture all of these cases and then let the CDC sift through and figure out which ones are actually real, because there's a lot of science that needs to be done, a lot of predictions that need to be made based on what we find from these cases. So when you hear about more cases, it shouldn't alarm you. This is part of what happens during an outbreak investigation, and we expect to see things. Like Dr. Hacker said, these are likely caused by viruses that are everywhere, so they're going to be popping up all over the country, and Pittsburgh is no different, so we will probably see more cases.
How often do you get a situation where a full-fledged investigation goes on like this? You get all of the data that you can, all the samples from the people who come down with the disease, and you can't find anything.
So in this particular condition of AFM, there have been cases where they've not been able to identify any causative agent. And as a result, we're sitting where we are today without a real sense of it's particularly caused by this particular agent. When you are able to identify an agent, then you're able to also develop a vaccine for that particular agent. So I think we're still in this exploratory phase of trying to gather as much information as possible, and I think that's why it's imperative that all of that is in one particular central location so that they can understand this condition to the greatest extent possible. So we are encouraging, physicians and families, if you begin to who are having these types of symptoms, to see your physician right away and to get those tests done.
I would just say that, people in the general public are used to just finding one virus causing one disease and then a vaccine, basically the polio story. But science and medicine aren't always that clean cut. So what we're finding here is that maybe AFM is caused by more than one type of virus, and there's probably a genetic predisposition. There's lots of mystery. So it's not always like this neat Hollywood ending that they find the virus, isolate it, make a vaccine, and everybody's better. So sometimes it can take some time, and there can be mysteries, and I think that's sort of part of the allure of infectious disease, that you don't always know what's going to be behind these cases.
You mentioned genetic. I was going to bring that up. Is it a possibility that there is just a genetic thing with this, that the particular virus, whatever, or multiple ones that a child can contract, that they are genetically predisposed to be affected by that more than any other child?
Well, we know with any infectious disease, it's an interaction between the microorganism that's causing the infection and the person's immune system and their idiosyncratic genetics. So there's a spectrum of illness, and everybody responds a little bit differently. So I do think that when they really uncover the causes of these, they may find that there are certain individuals, because of their genetic inheritance and the idiosyncrasies of their immune system, are more likely to get this type of a reaction, and some who are not. But I don't think we're quite there yet, but I think that's kind of the holy grail, is figuring out exactly why these cases are occurring in the people that they are occurring in.
I want to bring this up because Dr. Williams brought it up in his news conference the other day, and that is, there are people who will say, well, the flu vaccine caused it, or the polio vaccine, may be the result of this. How do you address those people who say, well, I'm not going to have my child vaccinated?
At this time, first of all, they are identifying whether the children were vaccinated or not. But this has occurred in both vaccinated and unvaccinated children, and there is absolutely no indication that there's any relationship between this particular syndrome and vaccine.
The question then becomes, well, with polio, it started small. It's a long history as to how it suddenly blossomed, and it had to do with sanitary conditions and all that sort of thing, the advent of sanitary conditions. But polio started small. This is starting small, and polio just, exploded. You don't feel that this is the sort of thing that will explode like that?
It doesn't seem to be right now. We've had these outbreaks in 2014, 2016, 2018. It is spread by viruses that are related to polio, but it's not, like I said, not just one virus that's probably causing it. And we haven't seen this type of these waves of outbreaks the way that polio did. So I don't think that we have to put this at the same level as polio. So I think although people are making comparisons, and it's fair that they're making comparisons because some of the symptoms are the same, I don't think that this will ever reach the type of epidemic proportions that polio did.
So if you would give us your advice, share with your advice on everyday people working with children, how they should respond to this, what they should look for, should they be doing anything a little differently?
So again, I think Dr. Williams said this very well, and also you also mentioned this as well. I think what we are saying, what the Centers for Disease Control is saying, what the Pennsylvania Department of Health is saying is all the same, which is basically you should use good preventive strategies that you would for any virus. And so that means washing your hands, staying home if you're sick, getting your flu vaccine. If there's a concern about mosquitoes, making sure that you take the similar precautions that you would take for any mosquito-borne illness. That's basically what we can be telling people today. And then if you do see a child with those symptoms, to please go to your physician and talk with them.
Doctors, thank you so much for being with us this morning on the KDPG Sunday Edition. We'll be back with some final thoughts in just a moment.